Everyone's selling longevity right now. Cold plunge, red light, hyperbaric, peptides, testosterone. Most of it noise. Or is it? Today we're cutting through the BS and focusing on the science of longevity. This is about staying sharp, strong, and dangerous longer than the system expects. And sitting next to me is the guy who actually sees the blood work, not the influencers and not the hype. All right, let's bring in Dr. Todd Dorfman. All transparency here, folks. It's my personal doctor, great doctor. We've been working together for many, many years, and he's the one who's taught me about testosterone, peptides, and other things. What we wanted to do is, we had a great episode, a massively popular episode a couple of weeks ago about a longevity lab that's literally across the street from here. We took you through that lab, and there were some modalities that the claims were that it helps turn back the clock, so to speak, anti-aging longevity modalities. And I want to bring Dr. Dorfman in to discuss some of them. So Todd, really good to have you. Doc, let's start with, I think it was probably the most intense moment of that whole walkthrough, and it was those hyperbaric cells. I'm not calling them chamber because it wasn't a tube, it wasn't those metal tubes of the old days. They were literally almost like little airplane modules. It felt very, very comfortable. Tell us, is this for everyone? Tell us what you think of hyperbaric treatments.
Yeah, thanks for having me, Eric. Hyperbaric oxygen's actually been around for quite a while, and we use it to help heal wounds that are difficult to heal. So, for example, someone with a diabetic foot ulcer or something that doesn't heal at normal atmospheric oxygen, we put them in a chamber. That chamber increases the amount of oxygen that's in their blood and subsequently in their tissues. So I think Darren Slothberg is right that you do get increased oxygenation at the tissue level. The part that's a little difficult to ascertain is whether or not this really helps people with performance, athletic recovery. Does this help someone like you, Eric, who doesn't have a specific injury? Really, there are no studies necessarily to support that. The studies support that it does improve people with tissue injury, muscle injury, and other injuries. But there really isn't any long-term data that says it improves recovery, athletic performance, makes you get back to the gym better, faster, or prevents injury. We also use HBOT. Actually, there's a bunch of studies being done in football players with CTE. So that's also really an interesting area, but we don't have really any other proven benefit besides wound healing at this point.
So, Doc, the theory was, and I've heard this everywhere, not just at the longevity lab. I had plastic surgery, and the surgeon said, go in there, because not only because it improves healing, but also reduces inflammation. Now, I've read enough to realize that I think inflammation may be one of the most deadly things to your body, not only aging-wise, but disease-causing-wise. If you're reducing inflammation, shouldn't that be enough to maybe spend a few minutes in a hyperbaric every couple of days or every day?
Yeah, well, so you bring up an excellent point, and there are studies like post surgery or post plastic surgery that it does indeed reduce inflammation. But if you look at those studies further, there's not a lot of evidence that it improves outcomes. So if you take, a group of people who had the same facelift, for example, and then did hyperbaric oxygen. And the same group of people basically had the same procedure and they didn't have hyperbaric oxygen. In the end, the outcomes are pretty much the same. And again, that's specific injuries. So if you called me and said, hey, I was out surfing. I have this really bad wound on my shin. It's not healing very well. I would say, hey, let's try some hyperbaric oxygen. If you called me and said, I want to put a hyperbaric oxygen chamber in my house, the first thing I would tell you is that the portable ones and the ones that were on the prior show don't actually go to deep enough atmosphere. So it's like diving, like scuba diving. So you really need to get down to 2 or 3 atmospheres. That's where the studies are done. That requires huge equipment and huge, it's an industrial operation.
So you can't get the same level of pressure in one of those cells. I mean, literally,
That's exactly right.
It was plastic and it very comfortable, but so it almost maybe you need those big tubes, those canister tubes, look like you're in some sort of, they used to call it iron lung, didn't they?
Yeah, well, that was a little bit different, but that's what they are. Yeah, you need a big steel, chamber that can withstand that amount
Mm,
of pressure,
mm.
and it has to be done under medical conditions and medical supervision, and just the oxygen that's
Well,
required.
so what
You need a
about, Doc?
truck.
What about, maybe you're not going to have the reduced inflammation or improved healing for any sort of, surgical procedures you had or whatever. But what about this idea? And you mentioned CTE, but a lot of people say that hyperbaric may actually help stave off dementia in people aging.
Yeah, I've done, fortunately or unfortunately, in my practice, there are a number of patients who are interested in staving off dementia, or even more so than maybe someone who doesn't have an increased risk for it. But having said that, there's no evidence whatsoever that HBOT staves off dementia or any type of cognitive decline.
Now, okay, let me just throw this at you because we did another episode early on in the show where we talked about creatine. Now,
Mhm.
creatine may actually stave off some forms of dementia, yes?
Yes. So there is some evidence, and quite honestly, the safety. Whenever we talk about these things, Eric, we really talk about risk, benefit, safety, versus benefit. And creatine, assuming you're a healthy adult with normal kidney function, and not any specific medical problems which would preclude using it, it's very, very safe. And in fact, shows both some benefit and some preliminary studies to stave off cognitive decline, certainly in postmenopausal women. It does help in that area, and it also helps build muscle and muscle mass, which we'll potentially get to in a minute when you talk about testosterone replacement therapy. It basically works synergistically. So I think creatine is almost a no-brainer if you are a healthy adult.
Got it, got it. One of the other modalities that as you walk through that longevity lab, by the way, beautiful surrounding. Doc, I will tell you whether there's the science, perfect science there or not. If you're doing things that make you feel better, or at least you think you're feeling better, sometimes the power of suggestion alone can be helpful. You can weigh in on that. And I want to just talk to you about a little bit about the one of the other modalities. But how about just thinking you're feeling better, and maybe
Yeah.
it motivates you to do maybe to be healthier in the other parts of your life.
Yeah, no, I think you bring up an excellent point, and that's really a little bit of what I was alluding to before. If it's not harmful, and we have gazillions of people using hyperbaric oxygen for all different reasons, whether medical grade or these sort of less than medical grade. There's really no downside if done properly, and if it makes you feel better and it makes you feel like you're healing better, and it makes you feel like you have less inflammation. And even if those things aren't true, placebo's like 30, 35% in a lot of studies. And that's great. I'm glad it
That
makes
is
you feel
amazing.
better.
The human
Yeah.
body placebo up to
Yeah.
30%
Why
reactive
not? Yeah, I'm
to
all for it.
placebo
Yeah.
effects. I am too. I mean, I am too. Whether, there's certain things, we'll get to peptides in a minute where I'm not positive you prescribe some peptides for me. I'm doing them. I'm doing them exactly regularly, like you're telling me to. I think I'm feeling something and seeing things change, but maybe I'm not. Maybe I'm just trying to tell myself it's working because I want it to work. Oh, we'll talk about. Doc, one of the other modalities over there was the cold plunge. Now I've done cold plunge before, where you're actually getting into these sometimes 33, 35-degree tubs
Mhm.
with very, very cold water, and you get out and you feel you can almost feel your metabolism moving. The cold plunge. Now his cold plunge, you don't even get wet. You sit on a layer of
Oh,
plastic, you submerge, but the plastic's prophylactic, so you're not even getting wet because it's
mhm.
easy. You get up, you go, and you go on your way. It's not a half
Sure.
hour or 45 minutes for a 5 or 6 minute plunge. What are your thoughts
Sure.
on the cold therapy?
Yeah, well, it's interesting, and I think it was sort of characterized as a palliative type of treatment, like more like a Tylenol or getting a massage, and I would wholeheartedly agree with that. So there are studies that show that cold plunge um, does temporarily, that's the key, temporarily reduce some inflammation. It works by vasoconstriction, so it constricts the blood vessels. It decreases blood flow, swelling, and oxygen to the tissues. So now, if you look at studies, not necessarily in cold plunge, but let's take something really common like icing a sprained ankle. or a tennis elbow. The studies, unfortunately, don't really bear out that that's helpful in the end. So it does make you feel better temporarily. It definitely can decrease pain, inflammation, swelling, all those things. Post-operatively, we do it all the time because it helps with those things. But in the end, it doesn't change
Does it
much.
burn fat though, Doc? I read that it burns brown. It creates your body's trying to stay warm, so it increases your metabolism. It searches out the easiest fat to burn and burns fat for energy quickly, and that may be a benefit.
Yes and no. So yes, so if you exercise in the cold air, so let's say you come up to Colorado altitude here, and it's really cold, and we go cross country skiing or something for an hour. You definitely have a different metabolism, higher metabolism. You burn different fats at that cold temperature, and so that is true. The thing that's unclear is whether or not you spend enough time in the cold plunge. I mean, those aren't very comfortable, obviously. Whether you spend enough time in the cold plunge for your metabolism to actually shift in that way, and you're also not exercising in the cold. And that's really what the studies are when they relate to
I will
fat
tell you,
metabolism.
you changed my life because you prescribed testosterone and creatine and all. It was good, but it wasn't until, and you really, really pushed me, and I didn't want to do it. I've walked every single day of my life, sometimes 6, sometimes 8 miles a day, and I didn't want to go to the gym. But when you said that when the resistance training, you add that to the testosterone, the creatine, that was the game changer, Doc. I will give you credit for that because my body composition changed almost within weeks once I started adding. And I don't do it a lot. It's 15, 20 minutes, maybe 4 or 5 times a week, and it's not a lot. And I walked less, and I turned it to that, and it wasn't a zero sum. It was probably similar amount of time, but a lot more definition came. I want to get to light therapies. Before we do that, is there any benefits to heat, to the sauna? Because a lot of places will say do 30 minutes or 25, 30 minutes in the sauna and then cold, and that'll jack up your metabolism.
Yeah. So the hot cold theory, again, I don't think you're probably spending enough time in either modality, and you're not exercising in those modalities. So, it's unclear if that really changes metabolism or not. It does make you feel better. So to your point before, it really does make people feel better. Their sense of well-being, as it's stated in the studies, it does improve. There are studies with saunas like the Japanese onsen, right, in the hot springs and things. So people that use those regularly actually do have lower blood pressure in general, lower cortisol, lower stress levels. So maybe it's because those people have time to go to the onsen every day, and or maybe it's because the onsen makes them feel less stressed. But the long and the short of it is those studies are true. When you get to red light therapy, it's very interesting. So this is one of those things. By the way, this is called photobiomodulation. Is the fancy name. So basically, you're beaming red lights into the skin, and the certain part of the cell called the mitochondria. There's a certain part of the mitochondria that essentially absorbs that red light and causes activation of those mitochondria.
Just the light, just the wavelength of the light is actually activating mitochondria.
That's exactly right.
Yeah.
So it does actually activate mitochondria. So in other words, there's a certain cytochrome, not to get too technical, that absorbs that light, and that's specific wavelength. And there are other wavelengths that they've tested, but in red light therapy, it has been proven to increase collagen synthesis, like in the skin, and it supports some evidence for wound healing and skin aging. But people have to be careful. Like this would be a modality that you would use in conjunction with, other things if you're trying to improve your skin. I think that there was a comment like if someone was like on a GLP-1 and lost like 60, 70 pounds and their skin was hanging off of them, this isn't going to do anything for that sort of thing.
What about the other, very quickly, I just for truncating for time, the other spectrum, the lights on levels of light on the spectrum, wavelengths, different colors, so to speak,
yeah,
allegedly are geared towards different types of healing or
they are. The important thing to remember here, Eric, is the light therapies are really proven in skin or superficial modality treatments only. So you can't put a light on your knee and have it heal your arthritic knee, and you
Mm.
can't put a light on your sore shoulder and have it heal your sore shoulder. Those studies don't exist,
And
but they do
and
exist in terms of skin.
dumb question off the beaten path.
Yeah.
I think I have seasonal adjustment disorder, which means when the days are shorter, there's less light. Is there any
Yeah,
science
that's a real
behind that?
thing.
Is it, and if it's a real
100%.
thing, is it also replaceable with artificial levels of artificial light?
Yeah, it does. And in Scandinavian countries, they do this all the time. So they have, sort of sun mimicking lights, so to speak, with a spectrum of wavelengths. And yeah, people use those on a daily basis if they have seasonal affective disorder. Unfortunately, where I live, it's sunny almost every day. So, but I don't see a lot of it. But certainly back east, when I was practicing originally there, it exists. There's no question, and definitely in the Scandinavian countries with the darkness.
And final thought, the EMG, the electromagnetic therapy, or G, whatever the G is.
Yeah.
Any science behind that?
Right. So in terms of using it, it depends what you're talking about using it for. So if you're using it for an injury, there is some science. It's used in physical therapy. It can help stimulate the muscle on its own, where sometimes people are having pain. So let's think of a knee surgery, and you want to stimulate the quadriceps. You can hook up these sort of TENS units and stimulate the muscle. There's not a lot of, we also use it for pain control, I should say. So if someone has a chronic pain in a joint, we can use nerve stimulation. But I don't know of any literature that it helps in terms of longevity, health span, aging, or preventing any injuries.
Got it, got it. And Doc, if folks want to know about the other ideas, the hormones, the testosterone replacements, the peptides, we've done that episode. We'll revert you back to, I believe it was episode 2 or 3 of The Edge. Dr. Todd and I talk about all those different therapies, and I'm a huge, huge advocate, and Doctor is a great doctor. Sedalian Health, Dr. Todd Dorfman. Thank you again for your time.
Thanks, Eric. You look great. Good to see you.
That's your fault. That's your fault, Dr. Todd. Thank you.
Take care.